So our lecture today is maxillary facial spaces. In this lecture, we are going to discuss the facial spaces surrounding the upper jaw. These include the upper lip infection, canine space infection, buccal space infection, infratemporal space infection, and pelletal or subperiosteal abscess. Let us start with the upper lip infection. Usually, the infection of the upper anterior teeth is situated in the labial vestibule. In particular, those of the upper central incisor. However, this depends on the root of these teeth. So, if the root of the upper central incisor below the attachment of the orbicularis oris muscle, in this case, the infection will be spread in the labial vestibule. But if the root of these teeth beyond the attachment of the orbicularis oris muscle, in this case, the infection will be spread within the mass of the upper lip, causing painful swelling of the upper lip. However, the infection of the upper lateral incisor is usually situated in the palatal side rather than labial side. This is because the root of the upper lateral teeth is usually inclined palatally, so the infection will be spread palatally rather than labially. The treatment of this condition is by doing incision in the labial vestibule. Medical treatment, antibiotics, analgesic, bed rest, rehydration also should be advised. The canine space, actually this space situated between levator anguli oris muscle and the anterior surface of the maxilla. The source of the infection is usually from infected upper canine, sometimes from infected upper first premolar. This is, or the involvement of this space with the infection depends on the relationship of the root to the levator anguli oris. So if the root of the upper canine below the attachment of levator anguli oris, in this case the infection will be seen in the labial vestibule or buccal vestibule. While if the root of canine beyond the attachment of levator anguli oris, in this case the infection will be spread to canine space, and usually the pus tracks in between levator labii superioris and levator labii superioris aliqui nasal. This gives facial swelling, and the swelling obliterates the nasolabial folds and may extend to the medial canthus of the eye. Treatment of this condition is by incision, and the incision should be situated in the labial or buccal vestibule. The buccal space is situated between the buccinator muscle medially and the skin and fascia laterally. The source of the infection usually from the upper posterior teeth, sometimes also from the infection of lower posterior teeth. Actually, the infection of buccal space gives painful facial swelling, and the swelling usually situated between the zygomatic arch from above and the lower border of the mandible from below. Sometimes it may extend anteriorly to the angle of the mouth and posteriorly to the anterior border of the ramus of the mandible. Treatment of this condition is by incision below the parotid papillae or the opening of Stensen's duct. The infratemporal space situated within the infratemporal fossa, which is bounded laterally by the ramus of the mandible and medially by the lateral plate of the pterygoid process. Usually the source of the infection from infected upper wisdom tooth. But also the infection of buccal space may spread to the infratemporal space as well. The patient usually presents with facial swelling. The swelling may extend to the zygomatic arch. And also the patient complains of trismus, inability to open the mouth because of involvement of temporalis muscle. Surgical treatment is by doing incision in the upper anterior border of the corneal process of the mandible. Medical treatment should be advised as well. The pelletal abscess, actually, the mucous membrane of the palate is heavily attached to periosteum or to the underlying periosteum. when there is infection, and usually the source of the infection from upper lateral incisor or from palatal root of the upper first molar. The pus tracks between the mucous membrane or the infection spread between the mucous membrane and the underlying bone, causing the swelling. This swelling usually situated in one line or on one side and does not crosses the midline. Usually swelling situated in one side and does not crosses the midline. The treatment of this condition is by doing anteroposterior incision. This is to avoid the neurovascular bundle in the region. Now, if the odontogenic infection is not treated, in this case it will lead to complications. And these complications include cavernous sinus thrombosis or cavernous sinus thrombophlebitis. It is a risky, fatal condition. Here, the infection spread from the teeth or from dental infection to the cavernous sinus within the cranial cavity. Actually, blood clot will be situated in the cavernous sinus, and this will lead to systemic and local manifestation. The patient may have severe frontal and periorbital pain, as well as the patient may have rigorous pyrexia, malaise. In addition to the patient may have also fascial swelling that obliterates the nasolabial folds and may extend to the medial canthus of the eye, edema of the upper and lower eyelid, redness of the eye, congestion of the conjunctiva also could be seen. Actually, the infection here spread from upper teeth or sometimes the after tooth extraction. It may occur also, this condition may occur after tooth extraction or due to periodontal infection or disease as well. This condition necessitates hospitalization and the patient treated with vigorous treatment of antibiotics, heparinization, heparin should be given as well, and also sometimes corticosteroid could be given as well. The another fatal and serious condition, which is one of the complications of untreated dental infection, is what we call Glutamine angina. Glutamine angina, usually, it is characterized by bilateral infection of the sublingual, submandibular, and submental infection. The source of the infection usually pericornitis or periapical infection of lower wisdom tooth. The infection starts in one side of the sublingual space, then by continuity spread to sublingual space of other side, then to the submandibular space, then to the other side of submandibular space, and eventually involving submental space by lymphatic drainage. The patient usually complains of difficulty in speech and swallowing. There is massive submandibular swelling, and also there is intraoral swelling. The intraoral swelling raises the tongue against the palate. For this reason, the patient has difficulty in swallowing and speech. Sometimes the edema may spread to the epiglottis, and this would cause airways obstruction. So the patient may complain of dyspnea as well, which necessitates tracheostomy procedure. As we can see here, that the patient looks like have double tongue, and sometimes also there is salivary drooling because the patient cannot swallow, so there is drooling of saliva as well. This condition is very serious and necessitates hospitalization. So the surgical treatment is by doing U-shaped incision below the chin, involving submandibular, submental, and through to sublingual space as well. Antibiotics should be given as well, analgesic, rehydration, and bed rest. Actually, this condition is very rare nowadays because of the establishment of antibiotics. There is another complication, which is osteomyelitis, as complication of dental infection, which will be discussed later on. Thank you for your attention.